I did some investigative journalism and spoke with a nurse working at a hospital in New York on the condition of anonymity for fear of retaliation from their employer. And the peek behind the curtain they granted me was unsettling.
Pay no attention to that man behind the curtain.
We spoke about the current state of healthcare, staffing shortages, patient care, and the effect of vaccination mandates. The scene they described was one of understaffing, exhausted healthcare providers, and forgotten patients. On September 27th, conditions quickly deteriorated. Unvaccinated healthcare providers were fired en masse, exacerbating staffing shortages under the pretense they put their patients in danger as they may be more likely to carry COVID. It is now well established that vaccinated persons can still carry COVID even if boosted. But in an attempt to compel uniformity in the workforce, potential negative externalities were overlooked. Remaining healthcare providers were saddled with the burden of picking up overtime to fill gaps in scheduling, sometimes working shifts as long as 16 hours. Since the firings, quality of care has suffered. Longer wait times, patients are bathed less frequently, and healthcare providers are unable to give the comprehensive care they pride themselves on due to time and staffing constraints. And although the public focus has mainly been on the nursing shortage, the problem isn't just nurses. It is nurses' aides and secretaries as well. Not only does the care suffer, so does the transparency between patient and family because they don't even have secretaries to answer the phone and relay the conditions of the patients to their loved ones. For example, in the telemetry unit my source works in, a nurse would ideally have no more than 4 patients. A telemetry unit just means the patients are under constant electronic heart monitoring. But even prior to COVID, 5 patients was common occurrence. But since COVID, 5 is sometimes 6. Not only due to COVID patients, older nurses have retired, some nurses have changed careers due to stress, and some have left for travel nursing. But since the mandate, nurses generally have 6 patients, sometimes even 7. How far are we from 7 becoming the standard with an occasional 8th? How much will care suffer? But it doesn't stop there. A nurse manager is supposed to oversee all the nurses and their patients, but these managers too are in short supply. And when they aren't there, the most senior nurse in the unit is assigned charge nurse. And while treating their own patients, they're supposed to oversee and help the other less experienced nurses. So the nurse in charge could have 6 patients of their own while overseeing another 3 nurses with 6 patients each. That's 24 patients. This overburdening and decreasing quality of care can lead to longer recovery times for patients, like if bandages aren't changed frequently enough, without even mentioning the toll it takes on healthcare providers never having an easy or calm day. They are up against it every single day. But the new CDC guidance has now undercut the premise for firing the unvaccinated in the first place, now allowing known COVID positive healthcare providers to work due to the staffing shortages that the mandate worsened. So instead of having a ready, willing, and able unvaccinated healthcare provider who may have a higher risk of carrying COVID, now they're actively allowing known COVID positive healthcare providers to work in order to address a staffing shortage they created via their unconstitutional and discriminatory mandate. And if you're considering going to the hospital for a non-COVID related illness, would this policy not give you some pause in knowing you could be treated by someone with COVID? This could lead people to not seek the care they need, causing unintended consequences. And if the unintended consequences of this mandate can be so dire, what kind of unintended consequences will this one cause? And thank you to my source, without which this video wouldn't have been possible.